So community treatment and care is to support the GP practices in the delivery of a lot of nurse-led treatments and things. It was brought in before the pandemic in collaboration with GP practices and the government, and I suppose its purpose is to try and take some of the pressure off of the already strained GP system.
It's been recognised that with the increasing population in Scotland that the pressures within GP practices has also increased. The procedures that we offer in both the CTAC clinics and the GP practices are blood sampling, blood pressure, height and weight, suture removal and recordings for chronic disease management. We also do ECGs for tracing your heart rhythms. In addition to these, in our CTAC clinics, we've also offer basic wound care, ear irrigation should you meet the requirements for this, PICC line care if you have this in situ, and routine catheter care. So we have 7 CTAC clinics across the city, and we also have CTAC staff based within the majority of the GP practices. CTAC service work in collaboration with the GP practices. We have access to the same system, although slightly limited in comparison to the GP practice, but we can share information with the GP practice and likewise the other way around. When it comes to the patient's care that sits with the GP practice, and all results from blood tests, blood pressures, anything that we undertake in the service will go back to the GP practice for them to manage the patient's care.
So booking an appointment with CTAC's really easy. If you just call our number, it'll be handled by one of the call handlers. Booking at community treatment care is often a really great experience for the patients because at times I'm able to offer same-day appointments, and patients are often really surprised how quickly they can be seen, thinking they're going to have to book for weeks ahead when maybe it's just 2 or 3 days.
It's not so much about not attending your GP and coming to a CTAC clinic, it's about giving you the choice. We still have our own CTAC staff embedded within GP practice, and we also have our clinics, which is our CTAC staff delivering the same high quality care that you would expect within a GP practice, but in our different locations across the city. So for people, if they're able to utilise public transport or come by car to one of our clinics across the city, they may be seen slightly sooner than they would be within their normal GP practice. So the accessibility within the clinics, they're all very accessible for patients to come in. We have wheelchair access in all our locations. We've got parking in the vast majority of our locations, and it's usually easy to get a spot. And also we've got accessible toilets and lifts for those clinics that are on more than one floor. So, yeah, really accessible for patients to come in. So we currently have 7 locations across the city. They're fairly well spread out, and we are looking at increasing the number of locations across the city. And it's quite helpful because some people work within one part of the city and actually are able to go on their lunch break or, on their way home or whatever. So, it's nice to have that bit of flexibility for where people can attend their appointment.
In the short space of time since CTAC has started, we have grown so quickly. And the number of locations has increased as well. Staffing numbers have increased dramatically as well. So yes, it's something that I think is going to be so beneficial to so many people, and I think it will continue to grow and develop.
Yes, so I work in the city centre, and I was offered 2 different locations nearby to where I work, and so I've chosen this centre, which is just a 5-minute walk away from work. Yeah, so I was asked through an e-consult reply from my GP to get a blood test booked. So I phoned the CTAC booking centre and was offered a blood test the next week. And I've just been here for the test, all on time and all completed. Yeah, I definitely recommend it. For me, there's no downsides compared to going to my GP. And yeah, offered a choice of service, choice of locations, and able to get a booking nice and easy.
I'm June McLeod, I'm James's wife. We come into the CTAC clinic for about a year, well it is a year, and it's just really a fantastic place to come. We really enjoy coming. It's just like a fun day. We come here. Karen runs a really good stack of girls. They're all nice. They all make it easy. I mean, we've never been anxious about coming. They've helped Jim's legs get better, and I just think there should be more of this place. The GP surgery, yeah, we needed that to start with, but I mean, when we first came here, I suppose we were a bit unsure because we didn't know what it was. I mean, after being here a few weeks, we just thought, no, this is definitely the service for us.
Staff work together for patients, ensuring patients come first in everything they do. We offer respect, dignity and compassion and strive to improve patients' lives and make everyone count. We are committed to providing excellent standards of good quality care.